Hi everyone, Dinesh Sarasena here, and today we're going to be talking about imaging the lumbar spine in preparation for a lumbar nerve root injection. As with my previous video about imaging the lumbar spine for the facet joints, I typically have the patient lying prone with the hips in a slightly flexed position. This is to eliminate the lumbar lordosis as much as possible, and this is particularly important when scanning and planning for injections around the lumbar nerves. And this is what you will see if you look at the patient from above. It's important to expose the back as much as possible, particularly from the thoracolumbar area down to the natal cleft. When scanning this area, I typically use a curvilinear transducer. The reason for this is that it gives a broad field of view, and also because it tends to be of lower frequency, it allows me to see deeper structures. When imaging this area, it's important to have the transducer in a long axis. And this is the diagram of what you will typically see. So if you're medial, you'll see the spinous processes, and as you move laterally, you'll see the facet joints, and then move further laterally, you'll see the transverse processes. Now, it's important to remember that you're not going to visualize the nerves, but what you're trying to look for are the transverse processes and the ligament in between. The lumbar nerve roots sit adjacent to this as they exit, and this is what you're aiming to target when you undertake the injections, and you can find out more in my next video. This is a typical image of what you will see when you are scanning this area. So you should see the transverse processes, and you should be able to distinguish the ligament as it runs in between the transverse processes. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter and Instagram. And remember to check out sportsmedinfo.sg.